So in this video we are going to discuss about the posterior compartment of the thigh. We'll discuss what all structures form the posterior compartment of the thigh. Mainly we go to the muscles of the posterior compartment of the thigh here. So we'll describe the origin, insertion and nerve supply and action of these muscles. First of all, we'll discuss about which muscle, that is the biceps femoris muscle. So biceps femoris muscle is discussed first. So what you see here is the pelvis. This is the ischial tuberosity, and this is the head and neck of femur. This is the greater trochanter, lesser trochanter. This is the tibia. This is the fibula. So we'll describe the origin and of the biceps femoris muscle. You should know that the biceps femoris muscle has got a long head and a short head. Now the long head of biceps femoris is originating from the ischial tuberosity. So one thing you have to know about these muscles of the posterior compartment is that these muscles are known as hamstring muscles. So what are the features of hamstring muscles? So a muscle to be called as hamstring muscle should have these features. So which are these features? It should have its origin from ischial tuberosity. And it should get inserted either into tibia, insertion either into tibia or fibula, and it should be supplied by tibial part of sciatic nerve. And the important one is action. The action of this muscle should be, it should cause extension at hip joint and flexion at knee joint. So, and hamstring muscle should have these four features. That is, it should originate from the ischial tuberosity. The insertion should be either to the tibia or fibula. It should be supplied by the tibial part of sciatic nerve, and the action is very important. That is, it should cause, a hamstring muscle should cause extension at hip joint and flexion at knee joint. So first we are talking about the hamstring muscle, that is the biceps femoris. It has got a short head and long head. And what is the origin of the muscle? So the long head of the biceps femoris muscle is actually a hamstring muscle, which is originating from the superomedial aspect of the ischial tuberosity. So this is the ischial tuberosity. This is the superomedial aspect of ischial tuberosity. So that is the origin of long head of biceps femoris. That is superomedial part of ischial tuberosity. So this is the origin of which head? That is the long head. Now about the short head, it is originating from the lateral lip of linea aspera. It is originating from the lateral lip of linea aspera. So that is the origin of short head. Actually, the short head of biceps femoris, you can see that it is not originating from the ischial tuberosity. And this short head is not actually a hamstring muscle. It doesn't form a part of hamstring muscle. Only the long head of biceps femoris muscle is called the hamstring muscle. So both these heads, one which is originating from the ischial tuberosity and the other which is originating from the lateral lip of linea aspera, this actually join together. And it gets inserted into the which bone? That is the head of fibula. So this muscle is the biceps femoris muscle. The biceps femoris muscle, it's getting insertion into head of fibula. So we have seen the origin, one head, long head originating from the ischial tuberosity, short head from the linea aspera, insertion into the head of fibula. Now what is the nerve supply of this? The long head is a hamstring muscle, so its nerve supply is by the tibial part of sciatic. Now we have said that hamstring muscle should be supplied by the tibial part of sciatic. Now the long head of biceps femoris is a hamstring muscle, so it is supplied by the tibial part of sciatic nerve. And the short head, it is supplied by the common peroneal nerve. And short head is not a hamstring muscle. Now the action is very important. So we will say it separately for the long head and the short head. So the long head being a hamstring muscle, its action is, we have said it, extension at hip joint and flexion at knee joint. That is the action. Extension at hip joint and flexion at knee joint. And it is also a lateral rotator of leg in semi-flexed knee. Semi-flexed knee. And what is the action of short head? The action of short head is only flexion at knee joint. So it doesn't cause extension at the hip joint. It is only a flexor at knee joint. Now we'll discuss about the other muscles, that is, which is the other muscle of the posterior compartment of the thigh, that is the semimembranosus. Semimembranosus muscle. We'll discuss about semimembranosus muscle. We'll discuss the origin and insertion of the muscle. So this is the ischial tuberosity, this is the femur, this is the tibia, this is the fibula, and we'll be drawing the origin of the semimembranosus muscle. It is actually a hamstring muscle, so it should have its origin from the ischial tuberosity. From which part of ischial tuberosity? It originates on the superolateral aspect of the ischial tuberosity, and it passes downwards and gets inserted into the posterior aspect of the medial condyle of the tibia. and it gets inserted into the posterior aspect of the medial condyle of the tibia. So this is the muscle. Now the tendon of this muscle gets inserted into the posterior aspect of the medial condyle. So origin of this muscle is from the superolateral part of ischial tuberosity Now it gets inserted into the posterior part of medial condyle of tibia. So that's all about the origin and insertion. Then what is the nerve supply? So the muscle is called it is called semimembranosus because it has got a flat tendon of origin. Now the nerve supply, we have said that hamstring muscle is supplied by the tibial part of sciatic nerve. Now the action of muscle is same as that of hamstring. This main action is, it is an extensor at hip joint and flexion at knee joint and it is a medial rotator of leg in semi-flexed knee. So this is one action which is different from the biceps femoris muscle. Biceps femoris was a lateral rotator of the leg in semi-flexed knee, but semimembranosus is a medial rotator of leg in semi-flexed knee. All other actions are similar. That is, being a hamstring muscle, this it causes extension of the hip and flexion at the knee joint. And the other muscle which we are going to discuss about is the semitendinosus muscle, and you can see that the semimembranosus muscle also runs along the medial boundary of the popliteal fossa. Now the semitendinosus. Now we'll discuss about the origin and insertion of the semitendinosus muscle also. Now this is the ischial tuberosity. The semitendinosus muscle is sharing a common origin with the long head of biceps femoris muscle. We have said that the biceps femoris muscle originates from the superior part of the ischial tuberosity. So semitendinosus is sharing a common origin with the long head of biceps femoris. So it is originating from the superomedial part of the ischial tuberosity and it is getting inserted into the upper part of medial surface of the tibia, getting inserted. So then this muscle is known as a semitendinosus because around in the middle of the thigh its tendon is starting. So most of the part of this is tendon. So as majority part of this muscle is formed by a tendon, it is known as semitendinosus. Now the origin of this muscle is from the superomedial part of ischial tuberosity and the tendon gets inserted into the medial surface of tibia, upper part of medial surface of shaft of tibia, upper part of medial surface of shaft of tibia. So actually its insertion is behind the insertion of sartorius muscle and distal to the insertion of gracilis muscle. So that's all about the original insertion. Now supply, being a hamstring muscle, it is also supplied by the tibial part of sciatic nerve. One thing which have to be known is that this muscle also forms a superomedial boundary of the popliteal fossa. It is forming the superomedial boundary of popliteal fossa, and biceps femoris is forming the superolateral boundary of the popliteal fossa. Now the action of this muscle, it is also hamstring muscle. So action is extension at hip joint, then flexion at knee joint, flexion at knee joint. Then it is also a medial rotator of leg in semi-flexed knee. So another muscle which forms a hamstring muscle is the adductor magnus muscle. So we have discussed about this muscle in the medial compartment of the thigh. So adductor magnus muscle has got an ischial part, it has got an adductor part. Actually this ischial part is also known as the hamstring part because it is taking its origin from the ischial tuberosity, infralateral part of the ischial tuberosity, and it is getting inserted into the, that is origin of the hamstring part or the ischial part. Hamstring part or ischial part of adductor magnus. This also forms a muscle of the posterior compartment of the thigh. That is origin is from, it is also a hamstring muscle, ischial tuberosity, and it gets inserted, its tendon get inserted into the adductor tubercle on the tibia. Sorry, insertion is to the adductor tubercle. Now the action of this muscle, it is causing extension at hip joint. So which are the muscles here? We have discussed about the biceps femoris, which has got a long head and short head. Actually this short head is not a hamstring muscle. The long head actually forms a hamstring part. Now we have discussed about the features of hamstring muscle. Now other muscles are semitendinosus, semimembranosus, and the hamstring part or ischial part of adductor magnus muscle. Now which are the other structures present in the posterior compartment? Other structures present in the posterior compartment are the nerve should be in this region. Which nerve is present? Nerve is in the posterior compartment of thigh. It is the sciatic nerve. And which other nerve is present here? It is the posterior cutaneous nerve of thigh. Posterior cutaneous nerve of thigh. Now, there is no major artery in the posterior compartment of the thigh. These muscles are supplied by the hamstring muscles are supplied by the perforating branches of the profunda femoral artery. So, it is supplied by the perforating branches of the profunda femoris artery. So, we have discussed about the muscles in the posterior compartment of the thigh. We have discussed about the now here. Now we will be having a separate video on the sciatic now and its cause. If you draw the posterior compartment muscle like this, so this is the biceps femoris muscle. From the ischial tuberosity to the head of fibula, and the semimembranosus muscle and we'll be having the semimembranosus muscle from the ischial tuberosity to the posterior part of the medial condyle of the tibia. And above the semimembranosus, we have the semitendinosus, which is sharing a common origin with the biceps femoris muscle. So the muscle also originates here, and it is present above the muscle, and it is getting inserted. So most of the part is tendon, gets inserted into the upper part of medial surface of tibia. So these are the muscles of the posterior compartment, that is the biceps femoris muscle and the semitendinosus muscle, and posterior to the semitendinosus you have the semimembranosus muscle, and the ischial part or adductor part of the adductor magnus muscle is also forming a part of the posterior compartment of the thigh. So these together are known as a hamstring muscle, but the short head of biceps femoris is actually not a part of hamstring muscle. So now the sciatic nerve is also running in this compartment, and the posterior cutaneous nerve of the thigh also runs in this compartment. There is no major artery in this region, but these hamstring muscles are supplied by the perforating branches of the profunda femoris artery. So that's all about the posterior compartment of the thigh. Thank you for watching this video. To see more videos from our channel, please subscribe the channel, and to get instant notifications on the channel, press on the bell icon. Thank you.